Suctioning via a tracheostomy. Pre-oxygenate the patient if it's indicated by turning up their oxygen. This is recommended if it is known that the patient desaturates significantly with suctioning, the patient has had any prior history of cardiac arrhythmias with suctioning, or the patient is very unwell, for example in the intensive care unit. Collect the necessary equipment. You'll need a bottle of water to clean the suction tubing, clean disposable gloves, appropriate size suction catheter, usually French gauge size 12, and suction tubing connected to a functioning suction system. After hand washing, place clean gloves on both hands. Open the suction catheter packet to expose the thumb control connector only. Attach the thumb control connector of the suction catheter to the suction tubing and transfer the suction tubing and suction catheter still in the packet to the non-dominant hand, exposing a little of the suction catheter in the process. Take an extra clean glove from the box and place on the dominant hand. This hand can now only touch the sterile catheter. Remove the suction catheter from the packet with your dominant clean hand and grasp the catheter about 10 cm from the tip. Ensure that the clean catheter does not come in contact with anything such as the bed. Introduce the suction catheter into the tracheostomy tube using your dominant clean hand without applying any suction. If a tracheostomy shield is being used, either suction via the hole in the shield or move the shield to the side of the stoma for the duration of the procedure. Advance the catheter until you feel gentle resistance. This is most likely the carina, or where the trachea divides into two. Withdraw the suction catheter 1 cm and commence suction by placing the thumb of your non-dominant hand over the thumb control. Slowly withdraw the suction catheter, rolling it gently between your fingers to prevent it from contacting tracheal wall tissue. Suction can be applied intermittently if needed. After suctioning, disconnect the suction catheter from the suction tubing and discard the catheter in the dirty glove. Rinse the suction tubing with tap water from an appropriate container used only for this purpose, and ensure you replace the tracheostomy shield to prevent hypoxemia. The suctioning procedure should take no longer than 10 to 15 seconds. Exceeding 15 seconds duration has been associated with an increased risk of hypoxemia and trauma. If there are copious secretions and the suction catheter has not come in contact with anything outside the tracheostomy, it can be inserted a second time. The catheter is not to be rinsed between suction passes. During and after the suctioning procedure, monitor the patient for any signs of complications, such as excessive coughing, transient hypoxemia, tracheal trauma, or cardiac arrhythmias.